have enough data to support the really long term. 15 years is like the longest term that we can ask in a good paper. And we have to make sure that we incorporate that in our ethic considerations when we're talking about complications that are related to dental implants. The option of replacing a tooth with an implant shouldn't be a major factor leading to the tooth extraction.
Well, I'm joined now by Professor Liran Levin from the University of Alberta. He is running a session on tooth or implant. What do you prefer? Liran, thank you very much for joining us.
Thank you.
Can you tell us, first of all, what options are there for tooth implant and replacement currently?
So during the last few decades, there's a lot of improvement in the dental implant area. So there are a lot of options for patients who are losing their teeth to replace them with dental implant. And this is some of the things that I touched in my presentation, because there's a trend towards replacing more teeth than we should sometimes, instead of actually trying to treat the teeth. The availability of the dental implant sometimes push us to place implants instead of actually fight the basic disease.
So how commonly then are they used? Do you think they are overused, and has the way that they're being used, has that improved?
So definitely, during the last decades, there are a lot of improvement in the materials that we're using, in the techniques that we're using, and there's a huge raise in the use of dental implants. And partially it's because of the need and the confidence that we have gathered with dental implants, but partially it's because we're too much confident with dental implants, and sometimes instead of trying to save teeth that we would save in the past, we're just giving up extracting them and placing implants instead of them. And this is those are the things that I was trying to emphasize.
You said this has become a trend. Why do you think it's become a trend?
It became a trend because both dentist and patient saw the success of dental implants, and sometimes they think, you know what, if I have to go through a root canal or a periodontal therapy, let's just get rid of that and place an implant, because there's a belief that implants are forever, they don't require maintenance, and they will not suffer from any diseases. But it's not true. I mean, implant required maintenance more than teeth, and they're required you need to have a good dental practitioner to place the implant and to maintain everything. And it's definitely not forever if you're not maintaining it properly.
So what approach would you really like dentists to be taking?
So the approach that we should take is, first of all, diagnose the disease, treat the disease, make sure that everything is stable, and then decide which teeth really need to be extracted, and if we're losing teeth, we'll replace them with implant. It's important to understand that implants should be there to replace missing teeth. They shouldn't be a reason to extract a tooth.
And I know you were talking about an evidence-based approach in the session that you gave. How important is that? What do you mean by that?
So first of all, it's very important to have evidence-based to what we're doing, because sometimes when you're doing something many times, you think that it works, you believe that it works, you sometimes remember the success, forget the failures. And when we're talking about evidence-based, we're talking about good recording and analyzing data to support the things that we're doing. So it's highly important in each field of medicine and dentistry. And again, in dentistry, in implant dentistry, we have to remember that implants are not that old, so we don't have a very long-term good data for dental implants. And if we're talking about especially young patient, but also old patient, if we want to think about the long term, the 10, 15, 50 years of dental implants, we don't have enough data for that. We do have that for teeth.
Well, we'll leave it there, but thank you so much for joining us. It's been very interesting.
Thank you. My pleasure.